Much later.
Oh, my daughter's bleeding. Wait. She's bleeding. She's like, oh, that's a lot of blood. It started about midnight. Can someone help me? It started about midnight and it was like this much. It was like a quarter size. And I started cramping yesterday in the afternoon. And then it went away when I started walking.
That is an expected finding. However, if it was as much blood as your menstrual period and was bright red, that may have indicated placenta previa or placental abruption. In that case, we would have called you. If you had passed any products of conception or felt an absence of fetal movement, then we would have called you as well. Let's go to the room, Emma. Also, on a scale of 0 to 10, how bad is your pain?
Is this my room? Okay. My pain's about a 5 out of 10, and it's on and off. And I'm coming. Mama's coming for you, baby. Like right here to like right here.
Emma is currently 39 weeks pregnant. She was brought in by her mom at 0-100 for complaints of bleeding and abdominal pain. She has a heart rate of 83 beats per minute, a blood pressure of 134/79, and a respiratory rate of 18 breaths per minute. Her vaginal exam revealed that she is 2 centimeters dilated, 70% effaced, and at a -3 station.
Oh, hi, Dr. Doolittle here. Unfortunately, I'm unable to be with Amma at this time, but I've been watching her on real time. And I'm glad to see that she came into the hospital when she did, because sometimes it's better to be on the safe side. So it looks like she's 39 weeks pregnant, which means that she's in her 3rd trimester. So during this time, small amounts of bleeding or spotting may be common, and this can be because of the uterus thinning as time gets closer to labor, or also too with the expelling of the mucus plug, or something that we call a bloody show. This is also an early sign of labor. Let's get back to the hospital and see how the care providers are doing with Amma during her labor.
How's it going? I'm the doctor. I'm Dr. Doofenshmirtz. Nice to meet you. Anyways, all right. So are we just gonna slice you and dice you now? Nah, I'm just kidding. I mean, well, maybe. I got a really busy schedule. Gotta pick up the in-laws from the LAX, and then I gotta make all the meals, and then how in-laws are. Am I right? There's no one here. Anyways, okay. So let's get this labor kick-started. All right, we're gonna go ahead and get an amnio hook. Nurse, amnio hook, stat. Amnio hook?
What's an amnio hook?
Amnio hook.
What are you doing to my baby?
An amnio hook is a giant crochet-shaped needle used in an amniotomy to rupture the amniotic sac. Providers request an amnio hook to break the amniotic sac when it is holding the baby from advancing through the birth canal. When an amnio hook is requested, the staff better get ready because a baby is on the way.
Did someone say lawsuit? Hi, my name is Sue Yu, attorney at law, and I've been watching this whole thing play out. Right now, the ethical principle of autonomy is at stake. Amma has not been told of the procedure and did not agree to having it. Therefore, she did not receive informed consent. Informed consent is meant to be provided by the doctor before a procedure occurs so that the patient realizes the risks and the benefits of the procedure and is able to determine for themselves if they want the procedure done or not. Right now, this hasn't been happening. So, Amma, if you want to sue in the future, Sue Yu is here for you.
I didn't know it was gonna hurt that bad, Mom.
Before I start your pericare, I just need to check the beeping from the fetal heart rate monitor. Okay. Yeah, that's going a little slow. All right. The fetal heart rate before was previously at 145 beats per minute, with moderate variability, accelerations, and no decelerations. But now it looks like the monitor is now displaying a sustained, prolonged, variable deceleration. As a nurse with exceptional critical thinking skills, I know that this type of deceleration is associated with sustained umbilical cord compression. As pressure on the umbilical cord increases, there is an immediate rise in fetal blood pressure, which is compensated by a severely low heart rate. This is giving the baby hypoxia and fetal acidosis. There is reason to believe that an immediate C-section may be ordered to prevent impending injury to the fetus.
What's gonna happen to my baby? Tune in next week.